The July 28th episode of Health in 2.00. Have we hit the point of ridiculous, Matthew Holt?
Man, woman, person, camera.
Health tech funding.
Okay, Jess, so now we know I'm cognitively all there, or at least 80% there, or whatever it is. What is this health tech funding? And we're still doing it in late July. It's so exciting. Have you got a show for us today?
Sure do. Get ready for this string of winners. You ready?
Okay, here we go. And
All
there
right.
are some big winners in this.
The biggest winner of them all is $200 million goes to Roe. Health Catalyst led this round. Tell me about this, Matthew Holt. What the hell is going on?
Well, Chrissy Farr says that they're making $250 million a year selling those $15 telemedicine visits, which you buy one and you get a monthly package of your pill to make certain parts of you grow more hair or become harder and stronger. And there's also a women's version called Rory. There's the men's for Roman. And then they've got like a pharmacy player as well behind the scenes. I mean, it kind of strikes me as nuts. There was a company called QuickMed at Health 2.0, which was many years ago, which was doing online Viagra sales, and they haven't made a noise from forever. And yet Roe and Hims and all these other guys, Neurex, come along and are building this whole, get to a pharmacy, basically get an OTC prescription without prescription. At some point, if I was the rival, so I get this stuff made I would make the stuff go all over the counter because, why the hell do you need a prescription for half the stuff? I don't know, especially if you barely get one from these guys. But nonetheless, they are growing really fast. You think about it, the valuation is supposed to be 1.25 billion or 1.5 billion for this round. They're damn nearly at Livongo's revenue, and Livongo's valued at 10 billion. So General Catalyst is hoping to turn that crank again. But it's a wild, wild world that we're having this sort of, telehealth part that's consumer for guys who can't be bothered to get out there some other way.
Didn't you want to say something about Hims, which was talking about going public via a special purpose acquisition?
Same thing. We'll see how much, we'll see how much they raise and whether they go public in this SPAC deal, the same way that Nikola, the Tesla competitor, did.
All right. What about Indigo Diabetes? This is an implantable CGM. They raised 38 million euros in a B round.
Yeah, there's going to be a lot more of this to come. There's obviously a lot more desire to figure out how do you do that continuous glucose monitoring, and that's another big engine in the field here. We'll see how it goes.
All right. What about Angle Health? They get a $4 million seed round. This is a health plan for startups. Y Combinator is in this one.
Yeah, this strikes me as being very odd. I spent too much time talking about Hims and Rory. Roe. I mean, this strikes me as being very odd indeed. That you've got to get a specific, individualized health plan. I mean, $4 million isn't getting you a drop in the bucket and starting a health plan. So what can you do? You can build some new systems. I mean, even Oscar started with 700 million when it was.
They have 8 people that work there. 8.
Well, I mean, the answer is this is like a design project, which may or may not figure out something. But even the ones that have raised money, right? So you've got Oscar, Bright Health, Collective Health, who raised hundreds of millions of dollars. They're still a drop in the bucket compared to the big Blues and Cigna and all these other guys. And maybe there is a need for specific health plans for startups. But I'm not sure. There's even this one that raised money, which is like a short-term plan, which you can get to ask me about, called Sidecar Health, which is a short-term plan. I mean, this stuff is also, by the way, incredibly vulnerable to the fact that in 4 months we're going to change of government, most likely. And if there is a Democratic House and Democratic Senate, which is looking the way it goes, a lot of this stuff was illegal under the ACA, and it's going to become illegal again soon. So I think it's very, very, it's very frothy indeed to be putting money into a new health plan, but we'll see how they do.
Frothy has been the word of the year. You started hearing it at JP Morgan, and we're still hearing it now.
I mean, the fact, look, crazy stuff.
That's one thing the pandemic couldn't kill was the frothy health stock market. It's
taken down the ML. It's taken down baseball, right? Well, it's taking down baseball as we speak. The Mariners are not Seattle Mariners, the other team. The Miami Marlins are all coming out with COVID. They got the English Premier League done without having another outbreak of COVID, but we know what's going on in Florida. We know what's going on in Texas. All this stuff about how do you manage these outbreaks, we're getting nowhere nearer to managing it. The stock market doesn't seem to believe it. It's still going equally gangbusters crazy. The NASDAQ is well above where it was. The S&P is close to where it was. And yet most of America is looking at, we're running out of unemployment insurance in 3 days' time. We don't have a deal yet in the Senate. Who the hell knows what's going to happen? So I'm sitting here in wonder going,
Delusional thinking. It's the new epidemic in America. Thank God we tested you at the beginning of this to see if you could remember.
I was 80% there. 80% there. I'm pretty good.
You and everybody else. All right, to check in with the cognitive insights of this one every once in a while, you can go to @BoltyBoy on Twitter. I'm @Jess Damasa. And of course, you can subscribe to our email newsletter up on the healthcare blog. Just go to thehealthcareblog.com, sign up, and get all of the content from the blog, the best of the week, curated and sent to your email inbox, along with these cute little episodes of Health in 2.0. Mr. Holt, always a pleasure to see you.
Lovely. I look forward to seeing you in the cognitive, on the other side of the cognitive impairment in a couple of days.
Yes. Bye, guys.
Bye.